Hi everyone, today we're going to learn something about liposuction. Liposuction is the commonest surgical procedure done by a plastic surgeon. If you take world statistics, among all the procedures done by a plastic surgeon in the world, liposuction is the one that's the most common. What is liposuction? Liposuction is the surgical removal of fat. So wherever there's fat, anywhere in the body, it can be removed by liposuction. Liposuction is not a modality to lose weight. It's basically to lose stubborn fat in areas which is very difficult to remove by exercise. A lot of people think that liposuction is a weight loss surgery, but it's wrong. Bariatric surgery is a weight loss surgery, and liposuction is a procedure just to remove the fat in certain areas. In the bargain, you will lose weight, but losing weight should not be the primary goal of liposuction. Liposuction is a surgical procedure, needs to be done under anesthesia, and should not be confused with the non-surgical modalities that are available. So who's an ideal candidate for liposuction? Liposuction can technically be done in anyone who is fit to undergo an anesthesia or a surgery. It should be done in people who are not overweight but are within 10 to 15% of their ideal weight. It is basically to contour one's body. Once the areas that need to be liposucked are adequately marked on the patient's body, the patient is given anesthesia. Depending upon where the liposuction has to be done, the anesthesia is given. If it's predominantly in the lower part of the body, a regional anesthesia can be given like spinal or epidural, but it's in the upper part, especially the arms or in the chest region, then general anesthesia is advocated. So basically in this operation, we infiltrate by giving small nicks in certain strategic areas. We infiltrate medicine which makes the individual fat cell swell up. And in this medicine, there is also material which decreases the blood supply to the fat, so thereby decreasing the bleeding. We have specialized cannulas or instruments which are used inserted into the body in different planes, which is connected by a tube to a liposuction machine. And eventually what happens is, with the passage of the tube within the fat, a column of fat is sucked out into a bottle. So the fat we remove with liposuction can be collected in a bottle, and it has a substantial amount of reading on it, so that you can calculate how much of fat that has been removed after the surgery. And depending upon the different areas that need to be done, the patient may need to be turned around or placed in the lateral position to give the adequate fat aspiration. A common question that everyone asks us when they are contemplating liposuction is, what is the downtime? Everyone is so busy, and the leave that one can take either from home as a homemaker or an employee from the office is very limited. So when it comes to liposuction, the amount of downtime basically depends upon the number of areas that are treated. If it's a single area, just the abdomen or the chest, then probably about 4 or 5 days rest is all that is required. Anyone who undergoes liposuction should wait for about 8 weeks for the final result to be very visible, because in liposuction we are aspirating the fat below the skin and above the muscle. So the skin has to shrink, and that takes time. So that's why the final result of liposuction would be evident only after adequate tightening of the skin, which generally occurs anywhere between 6 to 8 weeks. If there are stretch marks on the skin in certain areas, then the elasticity of the skin is lowered, and thereby the time may take a little more. So it can take up to about even 12 weeks if you have certain stretch marks in the skin. So a lot of people are very scared about liposuction these days. So why is it that people are scared about liposuction? Liposuction, if done for the correct reasons and by the correct person, is absolutely safe. It's as safe as any other operation. There is no added disadvantages or complications that can arise in liposuction, provided it's done by the correct person. The postoperative care in a patient who has undergone liposuction is very important, because performing the surgery is only about 70% of the treatment. 30% is the utilization of a proper pressure garment, which is generally started immediately after the procedure, and depending upon the areas that are treated, has to be used religiously for any period between 6 to 8 weeks. The advantages of using a pressure garment after liposuction is: number 1, it helps in decreasing the edema or swelling. Number 2, it helps in the skin to shrink and thereby helps in giving the ultimate shape that is required after liposuction. And it is commonly used immediately within the operation theatre itself, and it is only removed when you are having a shower. We generally advise to use the pressure garment depending upon your skin tightening anywhere between 5 to 6 weeks. Generally after liposuction, we start massaging that particular area after 3 weeks. That's when all the pain and everything is over and you are able to tolerate massage. Initially, we start a slow massage, but afterwards a vigorous massage will actually help in tightening the skin faster. A lot of people ask me whether the results of liposuction are permanent. By and large, they are yes. But it doesn't mean that, once your body has been contoured so well that you can go on a binge eating and then be free from fat. No, that's not correct. Liposuction is just the beginning to a healthy lifestyle. So after liposuction, just like as if you were even before liposuction, it's mandatory to have a good healthy lifestyle involving adequate, proper, healthy diet and an exercise regime. So it's not just like, you've had liposuction and you can eat whatever you want towards the rest of your life. It's wrong. You have to be careful, because when you've had liposuction, you will not gain weight in the area or you will not gain fat in the area where you have been liposucked, but you may gain fat in other areas. So if you've had liposuction for your tummy and your flanks and you're not careful with what you're eating afterwards, then you will see a disproportionate growth of fat in other areas. Another interesting factor that has to be registered is that, fat cells are numbered. We're born with an X number of fat cells. So even at the age of 30, 40 or 50, we still have X number of fat cells. So fat cells are growing in size and not in number. So when you deal with liposuction in a particular area, you're removing a percentage of those X fat cells. So that's why if fat is to regain in the remaining fat cells, it would require more blood supply, which is not there in those areas. So that's why it's very, very rare that you will gain fat again in the areas which have been liposucked. You should not get confused with the non-surgical modalities that are available, like cool sculpt and cryolipolysis and all these things which you see a lot of advertisements. These are for very subtle amount of fats, and it could only help in a little tightening of the skin and a little reduction of fat just below the skin. But when you have a considerable amount of fat, they won't work. So it's always better to understand about the liposuction procedure, look for a good doctor who's qualified to do this procedure, and then go for it, because liposuction at the end of the day gives excellent results. I hope you understood a little bit about liposuction today and the different modalities and protocols that are involved in it. For more information about liposuction, feel free to contact me either by email, WhatsApp, or just give me a call. Better still, just drop down into my clinic so that I can examine you once and give you a more detailed description about what to expect with liposuction. Thank you.